Hey everyone and welcome. Let's master the E-drugs. Here's the 25 most common medications tested. How many do you recognize? Edoxaban is used to prevent and treat blood clots, for example, in atrial fibrillation or deep vein thrombosis. Efavirenz is used to treat HIV infection. Enalapril is used to treat high blood pressure, heart failure, and left ventricular dysfunction. Enoxaparin is used to prevent and treat blood clots, for example, deep vein thrombosis and pulmonary embolism. Entacapone is used as an adjunct to levodopa/carbidopa for Parkinson's disease. Entecavir is used to treat chronic hepatitis B virus infection. Epinephrine is used to treat severe allergic reactions, anaphylaxis, cardiac arrest, and severe asthma attacks. Eplerenone is used to treat high blood pressure and heart failure after a heart attack. Epoetin alpha is used to treat anemia associated with chronic kidney disease, in chemotherapy, or certain other conditions. Epoprostenol is used to treat pulmonary arterial hypertension, with PAH. Eprosartan is used to treat high blood pressure. Eptifibatide is used to prevent blood clots during heart procedures, for example, angioplasty, or in certain types of heart attacks. Eravacycline is used to treat complicated intra-abdominal infections and complicated urinary tract infections. Ergocalciferol is used to treat vitamin D deficiency and certain bone disorders. Ergotamine is used to treat acute migraine attacks. Erythromycin is used to treat various bacterial infections, for example, respiratory tract infections, skin infections, and some sexually transmitted infections. Escitalopram is used to treat major depressive disorder and generalized anxiety disorder. Esomeprazole is used to treat gastroesophageal reflux disease, GERD, ulcers, and Zollinger-Ellison syndrome. Iazopiclone is used to treat insomnia. Ethambutol is used to treat tuberculosis. Ethinyl estradiol levonorgestrel is used for contraception, birth control. Ethosuximide is used to treat absence seizures. Etanercept is used to treat autoimmune diseases, for example, rheumatoid arthritis, psoriasis, and psoriatic arthritis. Etodolac is used to relieve pain and inflammation from conditions like arthritis and menstrual cramps. Ezetimibe is used to lower high cholesterol levels. Great job. Let's keep going. Here are the adverse reactions of the E drugs that exams love to test. Edoxaban adverse reactions: bleeding, hemorrhage, anemia, rash, elevated liver enzymes. Efavirenz adverse reactions: rash, can be severe, dizziness, abnormal dreams, insomnia, impaired concentration, nausea, vomiting, elevated liver enzymes. Psychiatric symptoms, for example, depression, anxiety, psychosis. Enalapril adverse reactions: cough, dry persistent, dizziness, fatigue, headache, hypotension, hyperkalemia, angioedema, rare but serious, renal dysfunction. Enoxaparin adverse reactions: bleeding, hemorrhage, injection site hematoma, thrombocytopenia, including heparin-induced thrombocytopenia, HIT, elevated liver enzymes. Entacapone adverse reactions: dyskinesias, worsening, nausea, diarrhea, urine discoloration, orange-brown, orthostatic hypotension, hallucinations. Entecavir adverse reactions: headache, fatigue, dizziness, nausea, elevated liver enzymes, lactic acidosis, rare but serious, severe acute exacerbation of hepatitis B upon discontinuation. Epinephrine adverse reactions: tachycardia, palpitations, anxiety, headache, tremor, dizziness, hypertension, arrhythmias, pallor. Eplerenone adverse reactions: hyperkalemia, dizziness, fatigue, diarrhea, flu-like symptoms. Epoetin alpha adverse reactions: hypertension, headache, fever, rash, joint pain, increased risk of serious cardiovascular events, for example, stroke, MI, and tumor progression if hemoglobin levels rise too quickly or too high. Epoprostenol adverse reactions: flushing, headache, nausea, vomiting, jaw pain, diarrhea, hypotension, chest pain, anxiety, infection related to infusion site. Ipersartan, adverse reactions, headache, upper respiratory tract infection, dizziness, fatigue, hypotension, hyperkalemia. Eptifibatide adverse reactions, bleeding, hemorrhage, hypotension, thrombocytopenia. Eravacycline adverse reactions, nausea, vomiting, diarrhea, infusion, site reactions, elevated liver enzymes. C. Difficile-associated diarrhea. Ergocalciferol adverse reactions, hypercalcemia symptoms, nausea, vomiting, constipation, polyuria, polydipsia, weakness, hyperphosphatemia, metallic taste, usually due to excessive dosing. Let's finish strong by doing the contraindications or black box warnings of the E-drugs. Edoxaban. Contraindications: active pathological bleeding, mechanical prosthetic heart valves, hypersensitivity to edoxaban. Black box warning: premature discontinuation. Premature discontinuation of edoxaban increases the risk of thrombotic events. If anticoagulation must be discontinued for a reason other than pathological bleeding, consider coverage with another anticoagulant. Spinal epidural hematoma. Increased risk of spinal or epidural hematoma when used in patients receiving neuraxial anesthesia or spinal puncture. These hematomas may result in long-term or permanent paralysis. Efavirenz. Contraindications: clinically significant hypersensitivity to efavirenz, concomitant use with certain drugs due to potential for serious and/or life-threatening interactions. For example, voriconazole, midazolam, triazolam, bepridil, ergot derivatives. Black box warning: none. Enalapril. Contraindications: history of angioedema related to previous ACE inhibitor treatment, hereditary or idiopathic angioedema, concomitant use with aliskiren in patients with diabetes or renal impairment. Black box warning: drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue as soon as pregnancy is detected. Enoxaparin. Contraindications: active major bleeding, history of heparin-induced thrombocytopenia, HCT, within the past 100 days, or in the presence of circulating antibodies, hypersensitivity to enoxaparin, heparin, or pork products. Black box warning: spinal/epidural hematoma. Increased risk of spinal or epidural hematoma when used in patients receiving neuraxial anesthesia or spinal puncture. These hematomas may result in long-term or permanent paralysis. Entacapone. Contraindications: liver disease, hypersensitivity to entacapone. Black box warning: none. Entecavir. Contraindications: hypersensitivity to entecavir. Black box warning: lactic acidosis and severe hepatomegaly with steatosis can occur, including fatal cases. Severe acute exacerbation of hepatitis B reported in patients co-infected with HIV and HBV who have discontinued anti-HBV therapy. Epinephrine. Contraindications: no absolute contraindications in a life-threatening allergic emergency. For other uses, contraindications may include narrow-angle glaucoma, shock other than anaphylactic shock, organic brain damage, or cardiac dilation, unless used as a life-saving measure. Black box warning: none. Eplerenone. Contraindications: hyperkalemia, serum potassium, 5.5 μQ/L at initiation. Severe renal impairment, concomitant use with strong CYP3A4 inhibitors. For example, ketoconazole, itraconazole. Concomitant use with potassium supplements or potassium-sparing diuretics. Black box warning: none. Apoetin alpha. Contraindications: uncontrolled hypertension, pure red cell aplasia, PRCA, that begins after treatment with any erythropoiesis-stimulating agent, ESA, hypersensitivity to the drug or its components. Black box warning: increased risk of death, myocardial infarction, stroke, and venous thromboembolism. ESAs increase the risk of these serious cardiovascular events when administered to target hemoglobin levels of greater than 11 GDL. Increased risk of tumor progression or recurrence. ESAs may increase the risk of tumor progression or recurrence in patients with certain cancers. Epoprostenol. Contraindications. Chronic use in patients with heart failure due to severe left ventricular systolic dysfunction, hypersensitivity to epoprostenol, or structurally related compounds. Black box warning. None. Aprosartan. Contraindications. Hypersensitivity to eprosartan, concomitant use with aliskiren in patients with diabetes. Black box warning. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue as soon as pregnancy is detected. Eptifibatide contraindications. Active pathological bleeding, history of stroke within 30 days, or any history of hemorrhagic stroke, severe uncontrolled hypertension, major surgery within 6 weeks, history of thrombocytopenia after prior use of a GPI-IB IWIA inhibitor, renal dialysis, hypersensitivity to eptifibatide. Black box warning. None. Eravacycline contraindications. Hypersensitivity to eravacycline or other tetracycline class antibacterial drugs. Black box warning. Warnings responding. None. Ergocalciferol contraindications. Hypercalcemia, vitamin D toxicity, malabsorption syndrome for oral forms if not absorbed. Black box warning. None. Ergotamine contraindications. Concomitant use with potent CYP3A4 inhibitors, for example, protease inhibitors, azole antifungals, macrolide antibiotics. Pregnancy, severe hepatic or renal impairment, peripheral vascular disease, coronary artery disease, uncontrolled hypertension, sepsis, hypersensitivity to ergotamine or other ergot alkaloids. Black box warning, serious and life-threatening. Peripheral ischemia, concomitant use with potent CYP3A4 inhibitors, e.g. protease inhibitors, macrolide antibiotics, may lead to serious and/or life-threatening peripheral ischemia. Erythromycin. Contraindications. Concomitant use with astemazole, terfenadine, cisapride, or pimozide. Risk of cardiac arrhythmias. History of cholestatic jaundice, hepatic dysfunction associated with prior erythromycin use. Hypersensitivity to erythromycin. Black box warning. None. Escitalopram. Contraindications. Concomitant use with MAOIs, or within 14 days of discontinuing. Concomitant use with pimozide. Hypersensitivity to escitalopram or citalopram. Black box warning. Increased risk of suicidal thoughts and behavior in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders. Esomeprazole. Contraindications. Hypersensitivity to esomeprazole. Substituted benzimidazoles, for example, omeprazole, lansoprazole, or any component of the formulation. Black box warning. None. Esopiclone. Contraindications. History of complex sleep behaviors, for example, sleep driving, sleep eating, after taking ezopiclone. Black box warning. Complex sleep behaviors, including sleep driving, sleepwalking, and engaging in other activities while not fully awake, can occur. Discontinue if such behaviors occur. Ethambutol contraindications. Optic neuritis unless clinical judgment dictates otherwise. Inability to appreciate and report visual disturbances, for example, in children too young. Hypersensitivity to ethambutol. Black box warning. None but can cause ocular toxicity. Ethinyl estradiol, levonorgestrel. Contraindications. History of or current deep vein, thrombosis or pulmonary embolism, cerebrovascular disease, coronary artery disease, thrombogenic valvular heart disease, uncontrolled hypertension, diabetes with vascular involvement, headaches with focal neurological symptoms, major surgery with prolonged immobilization, known or suspected breast cancer or other estrogen or progestin, sensitive cancer, liver tumors or active liver disease, undiagnosed abnormal genital bleeding, pregnancy, hypersensitivity to any component. Black box warning, cigarette smoking and serious cardiovascular events, increased risk of serious cardiovascular events, e.g. thrombosis, myocardial infarction. For women over 35 who smoke, thromboembolism, risk of venous thromboembolism, VTE, increases with combined hormonal contraceptive use, ethosuximide. Contraindications, hypersensitivity to succinimides. Black box warning, none but can cause severe dermatologic reactions and blood dyscrasias. Etanercept contraindications, sepsis or active infection, hypersensitivity to etanercept. Black box warning, serious infections, increased risk of serious infections, e.g. active tuberculosis, invasive fungal infections. Patients should be tested for latent TB before enduring therapy. Malignancy, increased risk of lymphomas and other malignancies, some fatal, particularly in children and adolescents. Atotolac. Contraindications, history of asthma, urticaria or other allergic-type reactions after taking aspirin or other NSAIDs, coronary artery bypass graft or CABG surgery, contraindicated for the treatment of perioperative pain. Black box warning, cardiovascular thrombotic events. NSAIDs increase the risk of serious cardiovascular thrombotic events, myocardial infarction and stroke, which can be fatal. This risk may increase with duration of use. Gastrointestinal risk. NSAIDs increase the risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. Ezetimibe. Contraindications, hypersensitivity to ezetimibe, active liver disease or unexplained persistent elevations of serum transaminases when used with an HMG-CoA reductase inhibitor. Black box warning, none.